Hi, Dr. Sasse here from Sasse Surgical. A lot of people have been aware of the link between the severity of COVID-19 sickness, or really getting ill from it, and obesity. It's come in the context of other pre-existing conditions were often talked about. And in one sense, it's a little bit unfair because there are certainly people without pre-existing conditions who've become very sick and who've passed away from COVID-19. But it definitely is important to recognize conditions and how we might work to mitigate those effects on getting COVID-19 and getting sick from it. I think we'd all like to think that COVID-19 is in the rearview mirror, but with variants, we've seen a few around here, and certainly we're hearing about that in the country. People are still getting this illness, and I have a feeling it's going to be with us for a while. But a very recent article was published that looked at metabolic surgery and then subsequently followed all of the people at the center who were admitted with COVID-19, and they were able to draw some very striking comparisons between the people who had had metabolic surgery in the past and those who had not, in terms of how they fared as they were treated for COVID-19. The study is a good one because even though it's not a large sort of randomized study of the kind of best quality that we would like, given the circumstances of COVID-19 illness, this is a study performed at the Cleveland Clinic, very respected researchers at a very respected U.S. institution. And so I think we can take these findings as being very likely to be widely valid. So what did they show? Well, in a nutshell, what they showed was that if people had a past history of bariatric surgery or metabolic surgery, or what most people call weight loss surgery, then they had a tremendous protective effect, meaning that they were far, far less likely to have to go to the intensive care unit, to have to be intubated on mechanical ventilation, or to die. And this is simply because the metabolic surgery has changed the internal biochemistry such that those people had lost a good deal of weight on average, and it may be that the effect is purely due to weight, but it may also be that there is a protective effect related to that new hormonal milieu that's been created after metabolic surgery that seems to get us back to closer to where we want to be in terms of health. Because we see this with the improvement of diabetes, hyperlipidemia, and resolution of things like sleep apnea and hypertension through not just a body weight mechanism, but a hormonal mechanism. So it stands to reason that the protective effect from COVID-19 may have other features to it beyond simple weight, or it may simply be the fact that carrying around that extra weight itself leads to strain on the lungs, and it stresses our capacity for our lungs and leaves us vulnerable to a virus which affects the lungs as the worst organ system affected. So it's really the first study, to my knowledge. It may be the only published study that really has clear outcome delineation that metabolic surgery protects people from the ravages of COVID-19. It probably does not prevent the transmission of COVID-19, but what it clearly does is prevents the severe illness, the thing that puts people in the hospital and ICU and on life support and what kills people. That seems to be a huge effect of having had weight loss surgery prior. So very interesting findings on that. Hopefully going forward, we will all be vaccinated and we'll see the numbers just drop down immensely, and hopefully this particular benefit of bariatric surgery won't have to be something we really talk about much in the future. But it just speaks to the vulnerability that we face if we are battling morbid obesity for many things that come at us in life, be it an auto accident or some problem with our heart or other organs, or a virus like COVID-19, that our body is just very ill-equipped to battle that problem. And yet one more reason why metabolic surgery improves longevity and health is that it makes us better equipped to fight conditions like that and like that COVID-19 virus. So I hope that summary of that recently published Cleveland Clinic study is helpful, and if you'd like to read more about it, you can certainly come to my blog on Sasse Surgical, where I discuss that in a little bit more detail and show some charts and graphs about the study findings. I wish you great health.